Yikes, oh my gosh. Okay, all right. That is such a bummer. Hi everyone, my name is Dr. Leslie. I'm a family medicine doctor who works in primary care and delivering babies. And I'm here with 17 to look at a few TikTok videos related to your period and tell you whether or not they've got true or false information. Okay, so this is the first one. All right, a period is where a girl bleeds from her hoo-ha. So, okay, all right. Let's talk a bit about anatomy here. So, a period is the shedding of the lining of the uterus, some tissue, mostly blood, and it comes out through the uterus, through your cervix, into your vagina, and then out of your body. So that's kind of the anatomic pathway. So a period is a monthly cycle. Yeah, that is correct. Wow, 3 to 14 days. Okay, let's pause there and talk about that briefly. Periods can be shorter, they can be longer. 3 days, absolutely some people get their period for 3 days, but I would say anything longer than 7 days at a time, you wanna go talk to a medical professional about that. Sometimes people can have prolonged bleeding or excessive bleeding that can be related to certain medical conditions. So I would say it's not necessarily within the average for someone's period to be 14 days. That's pretty long. So go talk to a doctor if that's the case for you. Once you get your first period, okay, it is normal for your cycle to be off. That's absolutely true. When people get their first period, their cycles can be off and maybe not come every month or be a prolonged amount of time, maybe 6 weeks rather than 4 weeks. So that absolutely is true. Overall, I'd give this video pretty good. Most of this information is great. One thing that I do like to mention is that there are lots of different types of people who have uteruses. It's not just girls. So there are people who are gender non-conforming or who are men who have uteruses. And so I usually like to use the term people when I talk about people having periods because gender can be fluid, people can be trans, and so I wanna make sure I'm inclusive to everybody. So this person is saying when you're using your Diva cup for the first time and it pulls out your IUD, yikes, oh my gosh, that is such a bummer. There is some data suggesting that menstrual cups can lead to a higher expulsion rate of IUD. So essentially, using a menstrual cup while you have an IUD can cause there to be an increased risk of the IUD coming out. Usually that's not unsafe, but it is bothersome and annoying for people. But that doesn't mean you can't use a menstrual cup if you have an IUD. I would just talk to your healthcare provider about this and let them know if you're using a menstrual cup and you have an IUD. That way they can tell you about any potential increased risk of your IUD coming out. They can be used together, there's just an increased risk of that happening. But I'm really glad she shared her experience about this because this is an important thing that can happen. So yeah. So I'm seeing here somebody say that you shouldn't use makeup on your period, and I have no idea why. I'm not really sure about that. Let's see what else they say. Don't touch the cotton because it can have bacteria. I'm not sure what cotton they're referring to. Maybe the panty liner or something like that. You can touch a clean panty liner and you have to remove the panty liner somehow. So you're probably gonna use your fingers for that. Just any time that you go to the bathroom and remove a pad, remove a tampon, make sure you do the normal thing and wash your hands afterwards.
Okay, ladies, come with me. Let's all agree to stop buying these products. They have finally come out with some organic options like these tampons. I love what this brand stands for, and there are no ingredients you cannot pronounce. These wipes are plant-based and they do the job to freshen up. We can all agree UTIs are of the devil, so take these pills to be in balance and ward off any infections or bacteria. But if you are having any problems down there, this is a good brand to look into. They are plant-based. If water doesn't cut it to wash down there, this is what I use. It's sensitive and fragrance free. Let's be real, I haven't used these before. I think it's kind of weird, but I know so many people that do.
I think cotton tampons are great. This one says it's organic. And I would just say don't use a scented tampon if you do use a tampon. So that's great. Down there, wipes. I have mixed feelings about wipes. I think that wipes can be helpful for some people. If they just feel more comfortable using something wet to help clean off their vulva area, that's totally fine. If you're going to use a wipe, I would make sure to use one that's mostly just water-based, there's no fragrances, there's no alcohol in it. Even a baby wipe could be something you use that's unscented. And again, when you're using this, use it on the outside only. Don't put something like a wipe up inside. That area cleans itself and doesn't need to be wiped down with a cloth. So I'm seeing Honey Pot Soothing Lavender Vulva Cream. So a thought about cleaning your vulva and putting any lotions or anything on your vulva. I'm seeing Baby Dove as well. I would say if you're wanting to clean your vulva, it's okay. I would recommend using a unscented soap because that area can be very sensitive. I would only use the soap on the outside and not in between the labia, which are the lips. I would just let the soap wash down and kind of cover that area, but not go opening the labia apart and scrubbing on the inside. That can be very irritating. You're gonna wanna stick to something that is unscented, that is possibly for sensitive skin, that isn't gonna be irritating to the skin of your vulva, and make sure you're washing on the outside only with the soap itself. I love menstrual cups. I think they're a great option for some people. They can be really environmentally friendly, which is great too. There can be a lot of misinformation, but there's also some really good information as well. It's about finding the right source. Oftentimes, if you're looking for health information, this means finding a trained medical professional or finding a scientist. And you wanna make sure people are backing up what they're saying with evidence, links to trusted sources like the World Health Organization.